first procedure for insertion of intravenous cannula is to make sure that you verify the written prescription of the doctor of intravenous therapy. Second is to check the dummy arm and intravenous therapy fluid and other things needed. The next one is to explain and reassure the patient about the procedure and make sure that you follow the 12 breaths of medication. Good evening, sir. I'm your student nurse, Mark Angelo Quijano from Manila Central University Level 4, and I'm here to insert an IV therapy. Ang purpose po ng IV therapy ay para dito po idaan ang gamot na manggagaling po sa doktor upang mas mapabilis po ang ating paggaling. Make sure that you follow the 12 breaths of medication. Right patient, right drug, right route, right time, right assessment, right to refuse, right education, right approach, right education, right documentation, and right prescription. The next one is to make sure that you do the hand washing or hand hygiene before and after the procedure. The next one is to make sure that you wear gloves during venipuncture. The next one is to make sure that you choose appropriate site, location, size, and condition of the vein. The next one is to make sure that you apply the tourniquet 5 to 12 centimeters above the injection site. Check the radial pulse below the tourniquet. Before you hang the bag, make sure that the IV clamp is closed. Prepare site with topical antiseptic technique according to the policy of the institution, and then make sure that you follow the no-touch rule. The next one is to use the appropriate IV cannula, utilizing the correct technique. Position the IV catheter parallel to the skin. The next one is to insert the catheter progressively, and then make sure that the back row is visualized. Hold stylet stationary. Slowly advance the catheter until it reaches the 1 millimeters of hub to the puncture site. And then flush it with water. Connect the infusion tubing of the prepared intravenous fluid aseptically. The next one is to open the clamp and regulate the flow rate. The next one is to secure and apply appropriate taping technique. Tape a small loop of intravenous fluid for additional anchoring. Apply splint if needed. Calibrate the IVF bottle, and then regulate the flow of the infusion. Label on the IV tape near the IV site, indicating the date of insertion, type, and gauge of the IV catheter, and then countersign. The next one is to label the plaster on when to change the IV fluid. Observe the patient and report any untoward effect. The next one is to discard sharp and waste according to healthcare waste management. Lastly, is to make sure that you document it to the patient's chart and make sure that you endorse it to the next shift.